crisis and confinement affected people's lives and physical and mental being, and how effective the use of telemedicine was during the COVID-19. I will focus specifically on the part of telemedicine in that research, which examined the role and effectiveness of the telemedicine use during the pandemic and how to enhance the services in the future. I will focus. I will be speaking about the shifting to telemedicine and how that has affected healthcare, advantages and limitations of current practices of telemedicine, and recommendation for improving it from doctors and users' perspective. Just okay. And I will open it for questions and comments at the end of my talk. And feel free to ask in Arabic or English. If it's in Arabic, I will switch to Arabic. And now let's begin. In line with the recommendations of World Health Organization to offer telemedicine services, the healthcare had shifted to them in many countries during the pandemic. Telemedicine can broadly defined as the use of telecommunications technologies to provide medical information and services. There are a number of factors led to implementing telemedicine during the pandemic. First of all, pandemics pose unique challenges to healthcare delivery. As healthcare resources continue to be stretched due to the increased burden of the coronavirus disease, uh, due to the health services can be partially or completely disrupted in many countries, telemedicine can be an effective way to rationally allocate medical resources. As you know, COVID-19 has changed people's daily lives and routine in many ways, and due to the measures were taken to tackle challenges arising from the spread of coronavirus, such as lockdowns, quarantine, restricting public gatherings, shifting to remote work, and online learning. Under such situations, it is understandable that people are experiencing significant changes in their behavior and the quality of life, and increased demand for mental health services as well. Therefore, telemedicine may be an effective way to deliver care to people who need it in their homes. As part of the joint project between us and UNDP, we conducted in September a household survey to evaluate the social economic impacts of COVID-19 in Bahrain with a sample size of 700 Bahraini adults. The results of that survey were actually the starting point of for the research we did on telemedicine. One of the questions covered in that survey was the impact on the allocation of time to non-work tasks like homeschooling, exercise, volunteering, and etc. We found for Bahraini, preparing meals, assisting and supervising children and the elderly, and consuming media all received a significant larger allocation of time, whereas health and some tasks all witnessed significant declines in time allocations, which means people reduced their visits to doctors and hospitals in the first phase of the pandemic. And this indicates a change in health related behavior and the tendency toward obtaining healthcare due to the pandemic. This change in the tendency towards obtaining healthcare is consistent with the decline in the volume and value of point of sale transaction in the health sector during the first 3 months of the pandemic. The figure represents the data requested from the CPP for our research project. It shows that the total value of transaction in April decreased by 65% compared with that of January to 4 million, indicating a substantial decrease in the tendency towards obtaining health services in the first 2 months of the COVID-19 in Bahrain. But after the end of partial lockdown in May, the use of health services started to hike and return to its pre-pandemic levels in Bahrain, as can be seen in the figure. This perhaps could be due to the decisions taken by Bahrain's public health officials and the procedures applied in the health facilities to provide care and reduce the risk of transmission of COVID-19 in line with the recommendations of World Health Organization to minimize non-urgent facility-based care while tackling the pandemic. Actually, in Bahrain and many other countries around the world, the shifting to telemedicine was among the most essential solutions for healthcare management and delivering timely care to patients during the pandemic. The National Regulatory Authority, NAHRA, issued a circular in March to all healthcare facilities in Bahrain, suggesting the use of face to face alternatives through providing telemedicine or teleconsultation in order to provide needed care to all patients at all levels, example home-based care, outpatients, and etc., while minimizing risk of virus transmission by reducing the number of people with symptoms of COVID-19 that have contacted the health facilities. And similarly, the Ministry of Health also called on providing online medical consultation using video and telephone calls, and also allowing people to renew prescriptions online using its website in order to ensure patients' safeness and well-being and deliver timely care and medication to patients, especially chronic cases, while they are staying at home. Given how the COVID-19 crisis has affected people's way of life and well-being and led to shift to telemedicine, which became an important tool during the pandemic, our research aimed to examine the role and effectiveness of telemedicine during that time and how to improve its implementation in Bahrain in the future. For this, online semi-structured interviews were conducted with representative health professionals and a group of patients to report their descriptive perceptions and experiences on the research questions. The health professionals participated in our research were selected for their background experience in chronic diseases and mental health, their practice experience in telemedicine, and their notable efforts in raising community awareness to the importance of physical and mental health during the pandemic. For the credibility of the interviews data and reducing the bias in our research findings, we conducted also interviews with a group of patients or users of telemedicine to know their experience with the use of the telemedicine and access to services in time of COVID-19, actually the medical services. They represented different ages and they needed different specialties like dermatologist, oncology, and others, as can be seen in this slide. All of the interviews were conducted between September and November last year with the participants using Zoom with the doctors and phone calls with the users because of the safety measures. How shifting to telemedicine affected healthcare during COVID-19? The analysis of the interviews with the healthcare professionals and patients who participated in this research revealed key findings First, shifting to telemedicine during COVID 19 played a key and effective role in mitigating the disruption of healthcare services and minimizing the transmission risk of COVID 19 in healthcare facilities in Bahrain. Doctors in our research found telemedicine for non urgent care and medication delivery services were more in demand compared to in person visits during the phases of the pandemic, as they found the number of telemedicine or virtual visits was higher than in person visits in their clinic during that time. Secondly, adoption of the telemedicine has created positive outcomes in the efficiency of healthcare services and cooperation in the healthcare industry. The good outcomes have been seen with with shifting to telemedicine include minimizing the unnecessary emergency room and in-person follow-up visits in hospitals, and promoting the safety of medical staff and high-risk patients, allowing focusing on the essential and urgent medical services and maintaining continuity of chronic and long-term condition patients' pre-planned treatments, maximizing the work efficiency as doctors found the daily number of patients who received urgent care in the hospital has increased, and the rate of appointment cancellation by patients has declined from 20% to 4%, as it allowed convenient and efficient appointment scheduling for patients, reducing time spent on follow-up care and eliminating travel to health care facilities. They found it easy option during the pandemic to see doctors. And on top of that, the adoption of telemedicine has created positive outcomes, cooperation and a cooperation among healthcare services, insurance firms, and pharmacies in COVID 19, leading to improved work models and altered workflows between them, and introduce new services on insurance and medication delivery during the pandemic. Also, participants in our research believe that telemedicine helped in maintaining the continuity of the healthcare and receiving pre-planned treatments during the pandemic. And they conducted interviews. A common view among participants was that healthcare access and receiving treatment were not impacted during the pandemic. For example, participants with cancer and diabetes stated that the pandemic did not affect the delivery of cancer or diabetes cancer or delay needed treatments, because the hospitals redefined the care delivery models using telemedicine to replace in-person follow-ups, uh, which non-urgent follow-ups, also sending medicine to patients' home, in addition to taking intensified safety measures in hospitals to reduce the risk of COVID-19 transmission during in-person visits. And most of the patients and users who participated in our research rated their telemedicine experience highly, and they expressed a desire of hybrid in person and telemedicine models for healthcare by hospitals in the future. They ranked their satisfaction with telemedicine as excellent or very good during the interviews we conducted with them, and all of them are likely to use telemedicine in the future, as they see it is more convenient, easier, and time and effort saving compared to in person visits for regular conditions, chronic disease management, follow up for less acute conditions, and prescription ordering. But some participants were uncertain about using telemedicine for their elderly fathers or mothers, patients in the future, as they feel that it is uncomfortable. Uh, Mostly elderly people feel uncomfortable with technologies, and they prefer face to face interaction. It's more preferable and suitable for them. Despite the advantages and positive outcomes were seen in the telemedicine, it is still in its infancy stage that in, uh, that it is encountered by several limitations which have been found in the pandemic. The most of which, the most important of which are difficulty in scheduling and making doctors' patient calls on time. When a doctor is unable to make the scheduled call on time, the patient has to wait, they say it, for more than 1 hour, 1 hour and a half, and just be ready to for the doctor's call. And also, some patients sometimes suffer from bandwidth, the poor connectivity or quality of video conferencing, and some of them lack of knowledge on how to use or how to access the telemedicine services. Also, assistance of family or other support is required to assist elderly people or people who do not know how to access or use the technology to access the telemedicine services. Another limitation is prescription of controlled medicines is restricted by telemedicine guidelines issued by health authorities. Psychiatrists are unauthorized to prescribe control medicine, but they argued that telemedicine network and records should be seen in the future as a new way to electronically monitor the prescription and purchase of control medicine. Also, telemedicine approaches are not covered by health insurance. Health insurance was not ready for the telemedicine services, and also some doctors say that some clinical activities involve face-to-face interaction, and especially in mental health care. Building on the aforementioned perspective on outcomes and limitations found in telemedicine after their real experience, doctors identified factors to be considered and a course of actions to improve telemedicine after the pandemic, and like health insurance. Health insurance company have to provide coverage for telemedicine access to all network providers. Um, Telemedicine provider has to use a reliable and secure telemedicine system, solution, or application, including applications for patients' data, video conferencing, chat scheduling, claims and billing management, and electronic prescribing. Most of the private clinics right now use WhatsApp application. It's important to have a special solution for the telemedicine services in order to maintain patients' rights and store records that might be needed for some legal issues or the cases of medical errors, la samah Allah. Establish a national network for telemedicine services and electronic prescribing system to control and monitor the prescription of controlled medicines, as the doctors suggested, by licensed the subscription by licensed private telemedicine providers, and dispensation of these medicines by pharmacies. Also establish regulations for telemedicine services implementation, as well as technical standards for telemedicine systems and record exchange. Integrate mobile healthcare applications and home applications into telemedicine system, which both can be used for remote patient monitoring and accessing patients' home reading. For example, blood pressure, level of sugar, and the blood weight, and etc. In order to improve the quality of the care and efficiency of the telemedicine services. These remote patient monitoring or mobile health applications are not part of the culture here in Bahrain. While we see it, they are commonly used in the Western world. And of course, change the health, the need to change the healthcare model. These models, the current healthcare models, will need to be changed, and the medical staff need to be provided with the training. The medical staff need to know how to use the telemedicine systems and services. Well, that's bring me to the end of my presentation. Now let me turn to your questions and comments. And as I said, feel free to ask in Arabic or English. I will shift to Arabic if you question in Arabic. I have to shift to the Suhail. Can you? I have to pause the share. Okay, but I want to pause these slides. I have to use this. Where is the chat? أوكي، نشكر الصحة على فكرة توصيل الأدوية للمنازل. الشيخ سلمان، محافظة العاصمة. Is it possible to continue with the telemedicine after the pandemic is over? Hopefully, all the doctors are looking to continue and providing telemedicine services if the Nahra and other official organization allowed them to continue in this service. And I saw from the patients and telemedicine users we interviewed them that they have high and strong intention to use the service in the future. The question was from Reem Dayasi. What about excuse me. What about the GCC countries? Are they moving toward telemedicine? Yes, all of them have shifted to telemedicine during the pandemic. What are some of the challenges that healthcare providers may face when returning to normal life after the pandemic is over? I think the health system right now face a burden and challenge uh, because of the pressure on them. They have to face the pandemic and also make sure that they are providing timely care to patients. Um, After the pandemic is over, I think they will continue on using the telemedicine services for a while. Uh, I don't think they will stop the service after they saw the positive outcomes they get. And regarding the Gulf, what is the significance of adapting telemedicines for Bahrain and Gulf? Um, there is an increase in both population and healthcare needs of GCC state citizens and migrant workers. The huge immigrant population challenges the capability of the already limited available healthcare resources and the escalating increase in healthcare use and cost annually. The region is faced with a disease burden that includes communicable and non-communicable diseases, for example, diabetes, cancer, and others, as well as mental health issues, which recently have increased due to the pandemic impact on people's life. Recent advances in technology have made breakthroughs in diagnosis and treatment modalities, innovative and cost-effective strategies are required to counter the healthcare needs of people living in the GCC states. Policymakers should emphasize the need to prioritize and strengthen care as a matter of urgency. كان هناك عمل مشترك بين محافظة العاصمة ووزارة الصحة فيما يخص اشتراطات ومعايير الصحة والسلامة في الصالونات الرجالية والنسائية. كان العمل جميل، تم تدريب 121 متطوع يراقبون الصالونات وتزويد المحافظة والصحة والصالونات. والله جهد تشكرون عليه. Okay, if no more questions. Okay. Thank you very much for your questions and comments. In summary, I can say shifting to telemedicine in Bahrain during COVID-19 played a key and effective role in mitigating disruption of healthcare services and minimizing the transmission of risk of COVID-19. Moreover, we saw that telemedicine was demonstrated to be feasible, acceptable, and effective in Bahrain and allowed for significant improvements in healthcare outcomes. Therefore, the developments of telemedicine is not only for social importance, but also economic importance and support the efforts of economic diversification in Bahrain. Thus, communication and cooperation between all healthcare communities, including official health authorities and regulators, public and private hospitals, insurance companies, pharmacies, is important to widespread adoption of telemedicine and its improvement growth as an industry in the future. Thank you so much for your interest and participation, and we hope to see you again in our forthcoming think talks. Thank you very much. Bye bye.